I see patients in my office all the time that have had a laminectomy prior, whether it be from canal stenosis or narrowing of the canal or something else, where they're trying to take pressure off those nerves, typically in the low back or lumbar spine. Now this one's for you, you know who you are. But we don't need to say your name. Might be a little HIPAA violation, it's unnecessary. But I love you and I'll see you soon. So after you have a laminectomy, how do you recover as quickly as possible? What are the big do's and what are the big don'ts? Okay, we'll talk about all of it. Now, I want you to think, first off, I want you to contact your doctor if you have any redness or swelling or numbness or tingling in the legs, any loss of control of bowel movements, anything like that. If it's really painful, you got to call them and get that sorted out and take their advice, right? First and foremost. But what I like to tell my patients is think walking, exercises and mobility, and nutrition. And then we'll talk about what to avoid, okay? So walking, you want to walk as soon as you possibly can. Granted, it's really not aggravating you, right? So the common recommendation is even the second day following surgery, get yourself walking. It promotes imbibition, or the pumping of blood. These are bones in your spine, by the way. The pumping of blood and the delivery of oxygen and nutrients to your spine, which is important for speeding its recovery and overall health, right? So definitely walk. That's first off. Don't walk to the point where you're in a lot of pain, or again, it's really aggravating you, right? That's listen to your body. That's when you stop. Riding a bike, a stationary bike, that could be good too. I love walking because I don't love to sit as much. Sitting increases a lot of pressure from gravity coming down on that lumbar spine, your low back, and it's just no bueno. That's the last thing we want. And the last thing we also want is just bed rest, right? So you got to get moving. That's big. So one is walking. What do we have in terms of exercises? Okay, so in terms of exercises, we want to, let's talk about the goal first here. So I love to strengthen the core. Now I think more common recommendations are let's strengthen the legs, let's strengthen the quads and the hamstrings and the glutes and things of that nature. And there's some core stuff, but I think the core is really big because if you have a really strong core, it's going to take a lot of pressure off of your low back. It's not going to have to work as hard all day and in the future, and it makes for a better prognosis, in my opinion, right? So we'll start with some basic ones that you'll see out there from orthos and things like that. And so say you're, very acute still, we could say, and it's just barely post-op, you're a few days after. Now, you're laying in bed, and what you can do, make sure you guys can see me, what you can do is lay like this. Now, almost step one for me, I would say two things. I like to keep the head like this with hands supporting. I'm already activating my core. I don't really have to do anything. I'm activating my core here. Now, that's one. Two is you can do it either with the hands down or up. I like up because it also takes some of that arch out of the low back, which we're going to talk about in a second here. But pumping blood. Here, I'm pumping blood right now. I'm moving my feet back and forth. So pretty much fluttering the feet, you can do both at once like this. You could do one and then the other. That's up to you. Okay, so that's one. You can do it again like this or like this. All right? Now, two, if we're going to, let's try to strengthen the quads a little, and very basic. We know the quads extend the leg, right? So, don't go doing that, what I just did. But one way you could do that is pressing your knee pit or popliteal fossa into the ground, right? So press your knee pits into the ground. Press those knees down. Try to close this space here, all right? Now, next, if that's easy for you, you can put a towel under your leg, and I like to have one knee bent here to take that arch out of the low back, have it press in the ground, and in fact, I love to press my low back in the ground even while doing this, and almost all the other exercises I'm going to show you, I should say all of them, you're going to press your low back into the bed or into the ground, wherever you are, and so that's activating your core. You'll feel right here, already just pressing, I'm closing the space here, I have an active core, right? So next is you put a towel under here, I don't have a towel on me right now, but you put a towel under your knee, and you extend the leg. And you extend the leg, and you extend the leg. It's just a more advanced version of a knee extension, okay? Now, then you can take both heels, you can put them on the ground, heels, right, like this, and you can, while pressing your low back on the ground, press down with your heels, press down with your heels, relax, press down with your heels, press down with your heels, relax. What's this doing? It's working on the hamstrings, all right, more posterior chain stuff, the back part of your legs, the back part of your body, right? So we can do those. We also have something called nerve flossing, right? Now, nerve flossing says you are going to bend one leg here, and what we should say what it says is you're flossing that nerve. Picture flossing
your teeth, that nerve is gliding, right? So it's a nerve glide, you could also call it. And this is helping that nerve stay nice and uninhibited in its function and the signals it's transmitting. And to help it just slide through those tissues is generally a good thing, right? Keeping everything as with as little constriction as possible, I guess is a good way to say it. That's around the nerve. So what you could do here is you can have your leg up in the air. Now key here is hold the other leg. This is going to keep your low back pressing the ground because this could be hard for everybody. All right, especially if you're in acute phase again. Now you're going to come up with the leg. I'll go slow, and as your foot dorsiflexes, this is dorsiflexion, your toes come to your head, right? Your head is going to go back on the ground. Then bend the knee and plantar flex, so point the toes down, and the head comes up. The head goes down, the head goes up. The head goes down, and so on. Fly on my foot. So, got that bastard. So that is going to help to floss those nerves. Now remember, one of the most important things here is this core activation, especially to me. And so you're going to do a pelvic tilt, which means you're going to try to tilt your pelvis up. You don't need to come up like this. Don't put too much stress on the low back. That's going to be, in the coming days and weeks. It typically takes 4 to 6 weeks or so to recover, all right, from a laminectomy. So, depending on your age and your, if you're athletic or not, and if you move a lot. So what you're going to do here is press your low back in the ground and slightly lift your butt off the ground, just your butt. Press your low back in the ground, lift your butt. You can do it like this too, with your head up, press your low back in the ground, lift your butt up. Press it in the ground, hold it for a few seconds, lift it up. So, these are things that you can do, really, really kind of to tolerance, right? And again, you don't want to push yourself beyond the point of comfort. You don't want to have any sort of sharp pain or anything like that, okay? So, yes, you're getting moving as soon as possible, but start slow, do a few sets of these, and if you feel fine doing 3 sets, it's really easy, go ahead and do 4, maybe even 5, something like that, of say like 10 reps of each thing that we just showed you, okay? The pelvic tilts are one of the more important ones, so I would focus on that and general core strength. Now, you're probably not ready for leg raises, so why do I say that? Leg raises are great for the core. These are great, right? But look what happens is your back, your low back's going to arch. That's some stress on your low back here, right? So if you can do it with your hands here, press your low back in the ground, and you can do this and it feels fine, okay, you could work up to that, and that's all well and good. Right? But again, listen to your body and progress accordingly. So now nutrition. So nutrition is enormous because you need to feed. We said walking promotes imbibition, the delivery of blood, oxygen, and nutrients to your spine to help it heal as quickly as possible. You need the nutrients, of course, to help it heal as quickly as possible. So what are 2 things I like to focus on? For sure, protein. Okay, definitely protein. It's not just for muscle, it's also a major component of bone and really most other tissues in the body, right? So almost all. So protein is big. I would try to get your body weight in grams of protein a day. That's also good for metabolism and promoting longevity, right? So definitely try to get your protein and get it from lean meats. One of the top things is fatty fish, and this brings us to the next point about nutrition. You want to have a lot of anti-inflammatory foods. You're in an acute phase, you just had surgery, you want to take down the inflammation, right? Your body's like, whoa, what just happened? Someone went in there and cut something, so we want to reduce inflammation, but we want to do it naturally. You definitely do not want to take NSAIDs, non-steroidal anti-inflammatory drugs, and those are things like ibuprofen, right? So you definitely don't want to take those, and why? They can slow the healing process, so avoid that shit for sure, okay? In terms of anti-inflammatory foods, extra virgin olive oil is absolutely fantastic. A shot a day also reduces your risk for all-cause mortality or all-cause death by 16%. So it's really great stuff. So you have EVOO, you have berries. Blueberries are king because blueberries are also great for your heart. They're great for your brain. #1 food for memory and focus, powerful anti-inflammatories. They have oleocanthal, oloripine, powerful antioxidants. Do extra virgin olive oil and pterostilbene and anthocyanins in blueberries, right? So both of those are really big. Fatty fish, salmon, mackerel, tuna, herring, sardines, anchovy. I love salmon. I think salmon is phenomenal. Very robust nutrition profile. You're getting good protein here, right? As you're not getting with the 2 aforementioned foods, but they have their own benefit. But protein and very powerful anti-inflammatory are the omega-3s that you find in wild-caught salmon. Make sure it's wild-caught
because if it's not, the farm raised has a lot more omega-6s, which are actually pro-inflammatory. So definitely stay away from that, okay? Things like ginger is good anti-inflammatory. Turmeric is in the ginger family, so turmeric combined with piperine or some source of fat to increase the absorption of the curcuminoids that we find in turmeric, they're responsible for reducing the inflammation in itself, right? So reducing joint stiffness, improving joint mobility. You see OA patients use them, curcuminoids, but 95% curcuminoids is what your supplement should contain. If you have curcumin it's in turmeric, by the way, in the spice, you're not really going to get that much curcumin. You're better off taking it as a supplement. Okay, so again, it's combined with piperine and it's standardized for 95% curcuminoids, powerful anti-inflammatory. Tea is very anti-inflammatory for the most part. Granted, there's not a bunch of sugar and shit added to it, right? So things like green tea, oolong, pu'er, all that kind of stuff, it's pretty good, right? So it's hard to go wrong with tea. Leafy greens. Leafy greens are great. Spinach, kale, arugula, Swiss chard, powerful anti-inflammatory. Here's a little secret. When you're going to have your leafy greens, pour that extra virgin olive oil on top of them. Why? The healthy fats in the olive oil help you to absorb the compounds in the greens to a much greater degree, because many of those vitamins, most all of them, are fat soluble, right? So they need some source of fat to be absorbed, and really, really improves, how they're going to affect your body, right, in a positive way. So leafy greens, nuts and seeds are also great, and there are definitely other things. A lot of fruits and vegetables, things that are lower on the glycemic index. I didn't mention anything that's really high in sugar, right? You want to avoid sugar, processed foods, refined flours, fried foods, any of that kind of crap, alcohol, smoking. You definitely don't want to do any of that. You want to avoid NSAIDs again, right? Non-steroidal anti-inflammatory drugs, so don't go popping ibuprofen. And you want to avoid activities that aggravate you. Use common sense, right? So you definitely don't want to bend and twist, things like that. If you're going to pick something up right here, what are you going to do? You're going to go like this? No. You're going to use your legs. This isn't moving. Core is tight and strong. Pick it up. Boom. You're going to put it down. Putting it down. Right? Your legs are going to get strong throughout the process. Remember, we want to strengthen these bad boys at the same time, taking pressure off the low back, using the core, so that all kind of goes hand in hand. You want to not drive. You don't want to drive, especially being in a car in general for more than 30 minutes. That is so much vertical pressure on the spine, 103% increased pressure on your L5. For example, that's just something we need to avoid. Okay, and again, you talk to your doctor first and foremost, but that's what I like to do in terms of, the advice that I give my patients that have had laminectomies, often with discectomy, things like that. With a discectomy, they remove a portion of the disc or the whole disc, right? You see microdiscectomies often. Fusion is a little more complicated. Fusion is something that really reduces somebody's mobility, especially in the interim, and that's a whole nother video probably. But some of these are also good for that. But this is more for somebody that's had that laminectomy, right? Because they're really common. Who do we got on here? Say what's up. We're going to go. What's up, Antasma? I love you. Rusty, Marcel, Dave, Bisham Nice. What's up, Killer Chinchilla? How you doing? Got my workout in before. I did a bunch of chest in the backyard. I'll post it at some point. Isaiah, Dandra, CB, Sapar, Bull City, King Gonzalez, Tulsa, Marlon, Mufta, how you doing? And Cameron August, Cam, what's up, girl? How you doing? She's an OG. Super U ambassador up in here. Check her out. Cameron Brooke. She's the real deal. Louis Taxit, Eagle, M. Art, Ed, and Edwin. What's up, Ash? How you doing, girl? You're probably in rough shape today. Rami, what's going on? As for now. So we got for you folks. What's up, Nello? Love you, man. Good to see you on here. Have a fantastic rest of your day. We'll see you tomorrow, baby. Not sure where, not sure when, but you're damn right we'll see you then. Have an awesome one. Brought to you by Shane Wen Wellness and Super U. Have a great day. We'll see you tomorrow. Thank you.